Stress. Adopting the right attitude can convert a negative stress into a positive one. Stress occurs as a response to demands placed on one's body and/or mind, and stress is of perception and is very individualized. Stress is linked to 3 of the leading causes of death: cancer, accidents, suicides. It is estimated that 1/3 of Americans are living with extreme stress. Hans Selye identified stress as a response of the body to any demand made on it. Research focused on physiological stressors, or what Selye called diverse noxious agents. Selye referred to these stress-inducing demands as stressors. Although Selye focused on physiological stress, since that time extensive research had shown that stress can be caused by a variety of emotional and psychological events. Emotional and psychological stressors can be positive or negative. The key aspect of stressors is that they require an individual to adapt. What is emotionally or psychologically stressful to one person may not be stressful to another. Circumstances and events are stressful only if the person perceives them as a stressor. Example of adaptation affected by type, duration, could be an individual dealing with the chronic stress of caring for a loved one may also be exposed to a multitude of acute episodic stressors, such as a car accident or influenza. Hypertension that occurs in response to acute stress does not increase risk for health problems. The increased risk for health problems is for a long history of hypertension. Once the environmental event or stressor stimulates the central nervous system, multiple responses occur through the activation of the Hypothalamic-Pituitary-Adrenal Axis and the autonomic nervous system. The nurse's initial strategy should be further assessment of the stressors in a patient's life. Massage therapy, guided imagery, or previous coping mechanisms may be of assistance to the patient. However, be sure to assess the stressors before using a coping mechanism. Music with 60 to 80 beats per minute, and music without words, and music composed by Mozart are frequently recommended to reduce stress. However, every person responds individually to music, and the personal preferences are important. When using imagery for relaxation, the patient should visualize a comfortable and peaceful place. The goal is to offer a relaxing retreat from the actual patient environment. Optimists tend to recover more quickly from an illness than pessimists. People with a pessimistic attitude tend to report poorer health compared with those on an optimistic attitude. Relaxation breathing is the easiest of the relaxation techniques to use. Resilience, resourceful, flexible, and have an available source of problem-solving strategies. Attitude, positive emotional attitude can prevent disease and prolong life. General adaptation syndrome. When the stressor is of sufficient intensity to threaten the steady state of homeostasis of the individual, this leads to a series of physiological changes that promote adaptation. The alarm reaction temporarily decreases resistance, may result in disease or death if the stress is prolonged and severe. Resistance is adaptation occurs or person advances to exhaustion. During this stage, physiological reserves are mobilized to increase the resistance to stress. The amount of resistance to the stressor varies among individuals depending on the level of physical functioning, coping abilities, and total number and intensity of stressors experienced. For example, a person who has been exercising regularly and is physically fit will have a greater ability to adapt to the stress of emergency surgery than a person who is deconditioned and has a sedentary lifestyle. Although few overt physical signs appear, the stressed individual is expending energy to attempt to cope. The resources available to the individual limit this adaptive energy. These resources include an individual's internal physical and psychological reserves, as well as social support. Exhaustion. Physical symptoms of alarm reaction may briefly reappear in final effort by body to survive. This stage can be reversed by external sources such as medication. An example is a terminally ill person who becomes alert and has stronger vital signs shortly before death. Neurochemical links among the nervous, endocrine, and immune systems is that the communication among these 3 systems is bidirectional. Stress affects 3 interrelated systems: nervous, endocrine, and immune. Activation of these systems affects other systems like cardiovascular, respiratory, gastrointestinal, renal, and reproductive. The complex process by which an event is perceived as a stressor and by which the body responds is not fully understood. A person's response to a stressor determines the impact that stress will have on the body. In addition, the body responds physiologically to both actual stressors and perceived stressors. The acute stress response is a state of physiological and psychological arousal characterized by increased sympathetic nervous system activity that leads to increased heart rate and respiratory rates, increased blood pressure, increased muscle tension, increased brain activity, and decreased skin temperature. Nervous system. The cerebral cortex plans a course of action after evaluating stressor in light of past experiences and future consequences. The limbic system. Mediator of emotions, feelings, and behavior that ensures survival and self-preservation. Reticular formation. This contains a reticular activating system to send alertness impulses to limbic and cerebral cortex. Stress increases frequency of alertness impulses, could lead to wakefulness and sleep disturbances. The hypothalamus is central to the connection between the nervous and the endocrine system. It regulates the function of sympathetic and parasympathetic branches of the autonomic nervous system. When an individual perceives a stressor, the hypothalamus sends signals that initiate both nervous and endocrine responses to that stressor. It does this by sending signals via the nerve fibers to stimulate the sympathetic nervous system and by releasing corticotropin-releasing hormone, which stimulates the pituitary to release adrenocorticotropic hormone. Stress activates the hypothalamic-Pituitary-Adrenal Axis. Hypothalamus releases corticotropin-releasing hormone. It stimulates the anterior pituitary to produce adrenocorticotropic hormone. The adrenal cortex secretes corticosteroids. Physiological effects of cortisol increase the blood glucose levels, potentiates catecholamine action on blood vessels, inhibits the inflammatory response. The release of cortisol, epinephrine, and norepinephrine increases blood glucose levels. The physiological changes associated with the acute stress response can cause changes in appetite, increased gastric acid secretion, elevation of blood glucose, and increase in respiratory and heart rate. Sympathetic nervous system stimulates adrenal medulla to release epinephrine and norepinephrine, which are known as catecholamine. The fight or flight response, the alarm reaction responses resulting from increased sympathetic nervous system activity. Corticosteroid, increased cardiac output, blood glucose levels, oxygen consumption, and metabolic rate. The cerebral cortex processes stressful stimuli and relays the information via the limbic system to the hypothalamus. Corticotropin-releasing hormone stimulates the release of adrenocorticotropic hormone from the pituitary gland. The adrenocorticotropic hormone stimulates the adrenal cortex to release corticosteroids. The sympathetic nervous system is also stimulated, resulting in the release of epinephrine and norepinephrine from the adrenal medulla. The end result is the inhibition of the immune system. Psychoneuroimmunology, interdisciplinaries involving the interactions among physiologic, neurologic, and immune responses. The brain is connected to the immune system by neuroanatomic and neuroendocrine pathways. Stressors have the potential to lead to alterations in the immune function. Immune system. As a result of this, mediation of stress by the central nervous system leads to corresponding changes in the immune cell activity. Acute and chronic stress can affect immune function by decreasing the number and function of natural killer cells, alter lymphocyte proliferation, and decrease production of cytokines. It is important to note that the network that links the brain with the immune system is bidirectional. Signals from these systems travel back and forth. The effects of stress on health. When a person sustains chronic unreleased stress, the body's defenses can no longer keep up with the demands. Over time, stress takes its toll. Therefore, stress plays a role in the development or progression of diseases of adaptation or stress-related illnesses. Examples of stress-related diseases include depression, fatigue, fibromyalgia, headaches, hypertension, insomnia, irritable bowel syndrome, and menstrual irregularities. Stress affects cognitive functions such as poor concentration, impaired decision-making, or memory problems. Stress also affects behavior by withdrawing from others, irritability, or substance abuse. The hippocampus plays an important role in long-term memory and is also important for cognitive functions such as spatial learning. The release of corticosteroids in response to stress appears to act in concert with certain neurotransmitters to produce stress-induced hippocampal damage. Long-term exposure to catecholamines resulting from excessive activation of the sympathetic nervous system may increase the risk of cardiovascular diseases such as atherosclerosis and hypertension. Control of metabolic conditions such as diabetes mellitus is also affected by stress. Behavioral interventions aimed at stress reduction and relaxation in conjunction with standard medical therapy have been successful in helping to manage these diseases. Stressful life events can make a person more susceptible to infection. For example, psychological stress may increase one's risk for developing the common cold. In a landmark study, healthy volunteers were inoculated intranasally with low doses of upper respiratory tract viruses. Subjects underwent physiological testing to determine the occurrence of stressful events in their lives and their reactions to such stressors. Results showed that the rates of viral infection and clinical colds increased with the degree of psychological stress. And in this study, social support buffered the harmful effects of stress. A person's cognitive and behavioral effort to manage specific external or internal stressors that seem to exceed available resources. Coping resources are characteristics or actions drawn on to manage stress and include factors within the person or the environment. The availability of coping resources affects an individual's ability to cope. Resources include like health status, belief system, problem-solving skills, social skills and support, financial. In the clinical setting, knowledge of the patient's resources will assist the nurse in supporting existing resources and developing strategies to expand the patient's coping resources. Since behavioral responses to stress include temporary changes such as irritability, changes in memory, and poor concentration, patient teaching will need to be repeated. Coping strategies can be divided into two broad categories: emotion-focused coping and problem-focused coping. Example of emotion-focused coping is discussion of feelings with a friend or taking a hot bath. Although it may not seem to be working toward a solution, emotion-focused coping is a valid and appropriate way to deal with various situations. Examples of a problem-focused coping: setting priorities, collecting information, and seeking advice. Both forms of coping can be used with stressors. Combination of the two strategies can be used with the same stressors. When a situation is unchangeable or uncontrollable, emotion-focused coping may predominate. When a problem can be changed or controlled, problem-focused coping is the most helpful coping strategy. A key concept in successfully coping is the use of coping flexibility. Coping flexibility involves the ability to change and adapt coping strategies over time and across various stressful conditions. Relaxation strategies. The relaxation response is the opposite of the stress response. The decrease in sympathetic nervous system activity leads to decreased heart and respiratory rates, decreased blood pressure, decreased muscle tension, decreased brain activity, and increased skin temperature. The relaxation response can be elicited through a variety of relaxation strategies, such as relaxation breathing, meditation, imagery, music for relaxation, massage. Regular elicitation of the relaxation response has proved to be an effective treatment for a wide range of stress-related disorders, including chronic pain, insomnia, and hypertension. Individuals who regularly engage in relaxation strategies are able to better deal with their stressors, increase their sense of control over stressors, and reduce their tension.